On the vaccination strategy, I know that it's still rolling out just within healthcare workers. But when you think about creating a successful vaccine strategy for the general population, there are a number of people who are quite skeptical, and including communities like Black and Indigenous people living in British Columbia who have reason to, distrust public health advice. How is the province approaching, those community-specific concerns as you start crafting that broader strategy?
Yeah, those are things that we're concerned about. We know that there are challenges with what we call vaccine hesitancy, and people very rightly have questions. This is a new vaccine, particularly the one that is licensed for use or has a notice of compliance, as we call it in Canada, and hopefully the Moderna vaccine will also get that soon. These are new technologies, new platforms. People very rightly have a lot of questions, and we've been seeing that in the clinics. I was at one of the clinics last week and talking to people about this, and what do you need to know? What do you need to understand to know that it's safe? I think part of our the important messages that are coming out from the public health community and from Health Canada about the processes for assuring that the vaccines work and that they're safe and that we have not lowered or changed any standards. It's still a very high standard so that we are confident that vaccines are safe and that they work, and what populations they work in. So we have started talking about that. We have our strategies, and healthcare workers, like everybody else, have questions about the vaccine and the new vaccines. So we are putting together the materials to answer those, and also to have it in the languages that people need to get the information in. So we are working. I've had many conversations as recently as last week with the First Nations Leadership Council. It's privileged to have some time to speak with them about the vaccine. So yes, I think these are very important considerations. We know that this virus the pandemic has differentially affected certain populations, and those are people who need to have equal or equitable access to vaccine so that they can protect themselves and their families as soon as possible. So we absolutely recognize that and are putting out as much information as we can about how the vaccines work, about how they were evaluated, how we ensure their safety, how we monitor very carefully for every vaccine given to make sure that we pick up any signals that arise. And we saw in the UK and in the US, there were some allergic reactions to the vaccine, so we've adapted our materials to help people understand what that means for you, and we'll continue to do that. There are many, many moving parts right now, including there's the amounts of vaccine that we're getting at different times is still up in the air. So as we move through the next few weeks, hopefully that will become more certain, and then we'll be able to tell people with a bit more certainty, what time frame are we looking at for when you might be in line for vaccine. So that's something that we will be giving you as much information as we can in the coming weeks.